Hi everybody, and welcome to this learning series about understanding and treating anxiety from an integrative perspective. Over the coming months, you'll get to meet members of the Health Lodge team and learn about their approaches towards the treatment of anxiety. This will include presentations from functional GPs, osteopaths, psychologists and naturopaths, and is presented within the paradigm of integrative medicine. Before we begin, I'd like to acknowledge the traditional owners of the land on which the Health Lodge sits, the Arakwal people of the Bundjalung Nation, and pay my respects to elders past, present and emerging. My name's Simon Bois and I've lived in the Byron Bay community since 1999. Here you can see a picture of me in my natural habitat as a psychologist, and in case you're wondering, that's a light bar used in EMDR treatment. I was a social worker until 2010 working for Byron Youth Service, and I was also volunteering for the Uncle Project, which was an organisation that mentored boys without active fathers. I moved into counselling psychology from 2010 and since then worked in clinical settings with an integrated team-based approach. My current practice is informed by three psychological treatment models: EMDR, IFS and Polyvagel theory, and I've endeavoured to list the key psychological models implicit in EMDR and IFS to really kind of highlight the point of how integrated most psychological practices have become. Interestingly, most psychologists would be considered integrative in their treatment approach now, with most contemporary models of psychology drawing upon multiple psychological perspectives, but not necessarily truly integrative in the sense that they also include complementary approaches, which we'll be talking about more through this presentation. Many practitioners within the Health Lodge team are integrative within their own discrete practice. However, they're also integrative in the sense that they work consistently with other practitioners with a different treatment focus to their own. And a welcome from the team of the Health Lodge. This is a dedicated group of practitioners that includes functional GPs, nurses, osteopaths, psychologists, naturopaths, body workers, kinesiologists and acupuncturists. And our team also includes the important role of our staff who greet and support the people who come to the Health Lodge into their healing journey, and they manage the challenging administrative back end of treating complex health conditions for both the practitioner and the patient. So what is integrative medicine? Well, it's an approach to wellness that combines conventional, traditional Western medicine, which includes things like lifestyle changes, psychosocial therapies, prescription medication, radiation therapy, and surgery, with complementary medicine, which sits outside the domain of traditional Western medicine and may include approaches like naturopathic therapies, nutritional medicine, functional medicine, yoga, meditation, massage, Chinese medicine, bodywork, and lifestyle approaches as well. Integrative medicine emphasises and understands the individual as a whole, and we'll talk about the blind men and the elephant at the end of this talk, and applies many forms of evidence-based therapies from the conventional or complementary domains. So a clinician can be integrative in their approach by incorporating several modalities within their own practice. And a clinician who has one mode of practice can also be integrative when they engage with other clinicians to assist them with their patients' care. The Health Lodge works with this perspective as individual clinicians and as a team, whether it be as a collective in clinical team meetings engaged in client cases, or working together in the clinic room with a patient, such as a combined appointment with a GP and a naturopath, or learning from each other through team learning spaces. The Health Lodge's vision, changing the future of medicine together, talks to a belief that a significant acceleration occurs in understanding and treating health conditions when a range of health modalities work together in an integrative way. Our strong interest in the integrative approach to medicine is also reflected in our values of doing care together, learning, person-centred practice, future-focused practice, and most importantly, in my view, the willingness to embrace complexity. So some of the fundamental considerations within integrative medicine is that there are many causes for the presence of a health condition, anxiety included, and that there's a range of systems in and around the human body that need to be considered to identify the relevant causes and the associated treatments for a person. As such, it also considers health by looking at the biological, the physical, emotional, psychological, social and the spiritual health of the person. And it also incorporates things like health promoting lifestyle changes, evidence-based complementary therapies and healing practices, and mainstream Western treatments, including psychosocial therapies and the use of prescription medication. Two really established practitioner bodies with a special interest in integrative medicine are the Australasian College of Nutritional and Environmental Medicine and the Australasian Integrative Medicine Association. And both of these hold conferences and provide education pathways in this area of integrative health, and they're both really worth having a look at. So let's start thinking about anxiety in particular. Anxiety is classified in a number of different ways, relating to the nature of the worry and how that worry is expressed. Generalised anxiety is a persistent, excessive or unrealistic worry about everyday things. Panic disorder is characterised by panic attacks associated with an overwhelming sense of disaster. Social anxiety is when someone experiences difficulty in interacting in social situations. There is increased self-consciousness, an inability to relax, particularly with new people and in unfamiliar environments. Agoraphobia is a fear of leaving known environments that are considered safe, especially home, just for a fear of not coping out in the world. And then we have specific phobias, which are an intense, irrational fear of everyday objects or situations like needles, dogs, flying, or heights. Post-traumatic stress disorder is a type of anxiety which occurs after seeing or experiencing traumatic events that usually involve the threat of injury or death, like physical assault, sexual violence, accidents, combat exposure, and often leaves the person experiencing flashbacks and fearing similar situations in the future. Complex post-traumatic stress disorder is a condition that can occur after prolonged and repeated trauma, particularly due to childhood abuse or domestic violence. And this form of trauma can disrupt the development of a person's identity and their ability to control their emotions and form relationships with others. Obsessive compulsive disorder is an experience where someone has uncontrollable obsessive thoughts like fear of a family member coming to harm, or fear of being contaminated, being poisoned, or fear of hurting themselves or hurting other people. And then there's a compulsion, which is an action, and usually a repetitive action, to try and address that fear and try and make sure it doesn't happen. So, for example, with someone with a fear of contamination, the compulsion is to constantly wash their hands. Separation anxiety is something that can be really quite stressful and overwhelming for young children when they need to separate from their mother or a main carer. And health anxiety, which is when someone has a really unrealistic fear of having a serious disease or illness, often with the compulsion to check that concern and seek assurance from others or from health practitioners. Often one type of anxiety will coexist with another type of anxiety, and it rarely presents as an individual mental health presentation. Anxiety is commonly found alongside other mental health difficulties, including ASD, autism spectrum disorder, attention deficit disorder and ADHD, Tourette's, developmental disorders, sensory integration and auditory processing disorders, substance use disorders, eating disorders, depression, oppositional defiance, and personality disorders. And anxiety frequently coexists with biological medical disorders, including those of the endocrine, gastrointestinal, musculoskeletal, neurological, cardiorespiratory, chronic pain, infectious disease, and I'd also include on that list sleep disorders as well. So what comes first? Is it the biological medical condition that's causing the anxiety? Or is it another mental health condition that's causing the anxiety? Or is it anxiety that's the driver for the biological and other psychological conditions? In most instances, this is a very difficult question to answer, but we tend to be drawn to this sort of question and answer because it gives us a direct solution about where to start treatment and a simple cause and effect equation to work with. Integrative medicine works with a more likely assumption that we have to investigate and work with a number of systems in the body to find contributing causes and work on them simultaneously. It's very rare that a psychologist is met with an anxiety case where their tools alone will fix the issue. We want it to be simple and straightforward, especially for the patient, but the integrative model invites us to embrace the complexity of ill health and work with it confidently and effectively. It would be great if psychology, medication, herbs or dietary changes alone would be enough, but we must work with a number of directions and the possible treatments that they may help. But nevertheless, people come to us with a specific issue of concern and relate to it as their primary experience of distress, and they're not sure what the contributing factors are. So if they come to a psychologist with anxious distress and our assessments show that to be present, we'll begin with a reasonable assumption that it can be supported psychologically. But the psychologist needs to also be open to other contributing factors that sit outside of their scope of practice. It's always a priority to give the patient some felt relief in the immediate, but an integrative approach requires more time and in-depth analysis as the drivers for distress are explored in more detail. Anxiety in and of itself is a really tough experience and impacts the whole person in a really intense and in overwhelming ways. Thinking, it becomes persistent and excessive in its worry. Concentration becomes difficult and distracted. Thoughts race. There's catastrophizing, a sense of hypervigilance and rumination. The mind becomes really flooded and decision-making is really impacted. In a person's behaviour, checking intensifies. They seek reassurance, become restless or avoidant. Sleep and appetite patterns are impacted and people can turn to alcohol, sedatives, illicit substances to cope with the distress. The nervous system is activated into a hypervigilant fight, flight, freeze state. Emotions are impacted with experiences of frustration, anger, irritability, fear, overwhelm, panic, distrust, uncertainty. And the physical body can experience things like a fast beating heart rate, palpitations, rapid breathing, shortness of breath, upset stomach, muscle tension, sweating and trembling, dizziness, dry mouth and difficulty swallowing, a restlessness or a trembling or shaking in the body, even feeling lightheaded or faint, and a sense of numbness or nausea and exhaustion. And relationally, in an anxious state, people can become much more dependent or much more avoidant from a place of distrust or insecurity. A more general way to think about anxiety in whatever form it presents is a condition of dysregulation in the human system. In particular, dysregulation in the form of hyperarousal, whether it's in the physiological, emotional, behavioural or mental systems. When a human system is dysregulated, it's a disruption that impacts the person's capacity to regulate effectively in the face of stimuli, whether that's stimuli from inside the body or externally. And in the case of anxiety, it's an over-regulated or hyper-aroused response. The person's window of tolerance, for some reason, has been reduced to the point that everyday issues and events now push them into hyperarousal. So with treatment, we're interested in increasing a person's window of tolerance by improving the health of the systems of the body. And should the person fall out of that window, we're trying to support that person to have the tools for effective self-regulation. So an integrative approach is a process by which we're trying to identify those things that impact the window of tolerance and find ways to increase its size. The field of counselling psychology is really becoming more and more orientated towards thinking about the nervous system's role in regulation and how counselling approaches can support the person to regain regulatory capacity of the nervous system by conscious actions through the mind and body and everyday behavioural actions. The nervous system considerations are a really interesting area for an integrative perspective. It's a system within the body where many disparate modalities come together in their work to improve mental health. In our team meetings, several modalities will be working together to bring a sense of regulation back to this part of the body. This often involves helping the nervous system remember the set point of feeling safe and at peace and at rest. And in polyvagal terms, that's about helping the ventral vagal part of the parasympathetic nervous system operate when the person is indeed in a safe environment. Modalities like psychology, meditation, yoga, acupuncture, massage, kinesiology, and craniosacral therapy all work together towards this aim. Polyvagal theories are a really interesting way of looking at our internal health and regulatory health. So it's really worth looking into further if it's something that you haven't explored yet. In particular, psychology has become very concerned about the impacts of trauma on a person's nervous system and then the subsequent impacts on a person's window of tolerance, the greater susceptibility to dysregulation, and the very unpleasant symptoms of anxiety that's associated with that. But let's step outside of the psychological paradigm and its considered reasons for anxiety and look at the other possible causes of dysregulation leading to anxiety and hyperarousal in the person. So other causes can be associated with adrenal issues, neurotransmitter issues, genetics, nutrient imbalances, environmental impacts like toxins, pyrrole disorder, structural impacts, gut imbalances, hormonal imbalances, lifestyle issues, infection, and neuroinflammation. And when we start to take into consideration other possible drivers for anxiety, the assessment tools that we can or perhaps need to use start to broaden as well. Psychology will traditionally use self-report questionnaires like a DAS-42, a K10, a Penn State Worry Questionnaire, or a Beck Anxiety Inventory, and that will help direct where talking therapy will lead for the person's treatment. We broaden our scope and look at other integrative assessments that we can include. We notice things like genetic testing, comprehensive digestive testing, testing of bloods, hormones, and mineral analysis, looking at organic acids and neurotransmitters, mycotoxin testing, and the list goes on. And with this broader approach to making sense of the drivers, the possible treatments broaden as well. But we'll leave the details of these important considerations to the experts in coming talks that will be coming up soon. And our next talk is titled Anxiety is Inflammation, and this will be presented by Dr. Igor Tabrizian, who's a functional GP at the Health Lodge. We'll let you know when this talk is available through the Health Lodge website. But he'll be exploring the well-researched connections between neurotransmitters and the modulation of the immune system, especially pro and anti-inflammatory systems. So this presentation is going to cover some interesting things, including serotonin, melatonin, histamine, dopamine, GABA, glycine, SAMe, and how they connect with anxiety and with our immune function. Following Dr. Igor's talk will be a presentation by Bois titled Anxiety, It's in Your Gut. And again, we'll let you know when this presentation is available through the Health Lodge website. And this is a presentation that's going to look at pathogens and neurotransmitters in the digestive system and their place in anxiety conditions and their resolution. So this will be a really interesting follow-up from Dr. Igor's talk, and will spread and cast the net wide for the way that we can think about and understand the presence of anxiety in a person. So let's finish with the parable of the blind men and the elephant, a story of a group of blind men who've never come across an elephant before and who learn and imagine what the elephant's like by touching it. Each blind man feels a different part of the elephant's body, but only one part, such as the side or the trunk. They then describe the elephant based on their limited experience, and their descriptions of the elephant are different for each other. In some versions of this parable, they come to suspect that the other person's dishonest and they come to blows. But the moral of the parable is that humans have a tendency to claim absolute truth based on their limited subjective experience, as they ignore the other people's limited subjective experience, which may equally be true. But this parable reminds us of the risks present when we work within the limited perspective of our own treatment paradigm. Each modality has a clear understanding of its part, but until we communicate our part to others, we can't know the whole of what we're dealing with, nor treat our part as effectively as we can. Treating others or ourselves with an integrative approach helps us address health so much more effectively. This may mean working in a more complex way, but the results are so much more effective. So I hope this introductory talk has been interesting and piques your interest, and I hope it encourages you and gets you interested in the subsequent talks that are in this series on understanding and treating anxiety from an integrative perspective. Thanks so much for having a look at this presentation, and I hope it's helpful in your journey as a clinician or as a person who's seeking to make sense of and address anxiety in your own life. Goodbye.